Today I will be giving an overview of ADHD. So what is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder. It tends to appear in early childhood, so usually children under the age of 7 are diagnosed with it. Symptoms or factors of it are hyperactivity, impulsiveness, and inattention. Looking more closely at the symptoms per se, hyperactivity and impulsiveness. So examples of those factors would be the child is noisy, they fidget, they can run and climb excessively and at inappropriate times, they can fail to wait their turn, they interrupt others, and they can talk excessively. And so looking more closely at inattention, examples include careless with detail, they lose things or are forgetful, they do not finish tasks, and they do not maintain attention, and they can be easily distracted. Some known risk factors of ADHD include the biological factors, so parents with ADHD have a higher likelihood of having children with ADHD than those that do not have ADHD. Also, premature birth. If the pregnant woman smokes or consumes alcohol during pregnancy, and also exposure to environmental toxins. There are also some possible causes of ADHD that researchers and doctors aren't real sure of, but one of them being emotional problems as a child can lead to behavioral problems, and those different behaviors can be classified as the symptoms of ADHD. Also, the family environment and their upbringing, more specifically family conflict, family coherence, and adaptability. So, for example, if a child is acting out and the parents don't reprimand their child and say, oh no, that's not good behavior, that behavior can continue and lead to behaviors that can be classified as ADHD. So the prevalence of ADHD varies by a lot. The rates have ranged all the way from 0.9% to 20%. One study said that the worldwide prevalence was 5.29%. On the other hand, the World Health Organization reported a pooled prevalence of 2.5%. But this was only based on 6 studies, so this could be why it differs by a lot. But looking at the picture, even though it doesn't necessarily show the prevalence of ADHD, there have shown some differences. So from 1997 to 2006, the diagnoses have increased by 3%. And then from 2003 to 2007, it has increased by 5.5%. And just looking at the United States map and seeing all the children who are receiving medication for ADHD, it varies from state to state, but in this case it's kind of regional. So the dark red is 5.5 to 6.5%. Where on the other end of the spectrum, the lowest is in the light pink, that's 2.1 to 3.4%. So ADHD and development also shows some differences. So symptoms tend to decline with age, but this could due to multiple factors such as changing the definition of what is diagnosed as ADHD. But persistence varies across studies all the way from 4% to 80%. But the estimated persistence is at 40 to 60% of affected children to continue to have the disorder into adulthood. So, looking at the chart to the right, it shows this fact a little bit. So, children tend to have a higher amount, teens a little less than that, and then adults a little less than that. Um, this could be due to other factors um, other than them being quote unquote cured. Um, Also, the map doesn't necessarily show the age range of the adults and children, but you can assume the numbers. So, ADHD can also differ across different demographics. For example, ADHD has been found more in boys than girls, more specifically, 2.45 times higher in boys than girls. And some other more controversial prevalence rates are ethnicity issues and socioeconomic issues. For example, some studies showed higher prevalence in African Americans. Another study saw that ADHD has been associated with lack of financial dependence, lower socioeconomic status, and lower education level later in life, so once a child is older. So, going into more analyzing of what I found, specifically the prevalence in children. So, perhaps ADHD is more prevalent in children than adults. Could be due to the fact that children tend to have more energy than adults. So, children are more likely to not be able to sit still, talk, and they talk excessively, and they're noisier than adults. This can lead to misdiagnosis of children that don't truly have ADHD, and this also could be why persistence tends to go down as somebody gets older. Their behavior just changes, um, and that could be why the ADHD behavior, classified behavior, also goes down. So, looking at ADHD, it appears that the possibility of misdiagnosis is very high. And so, the misdiagnosis can lead to a different prevalence of ADHD throughout the world. Um, and also, misdiagnosis can be caused because um, ADHD is considered a mental health issue. And so there's two different scales of how it can be classified. So there's the International Classification of Diseases and the Diagnostic and Statistical Manual of Mental Disease. And so, depending on what scale doctors use, there could be room for misclassification um, in children with ADHD, and this also could lead to why ADHD differs when those children become adults. They could go to a different doctor, and they could be diagnosed the other way, either misdiagnosed or actually diagnosed with ADHD. So, looking at the different forms of outreach that can be taken, um, one being that we need to educate our doctors on how to properly diagnose ADHD. Another would be to use one classification standard during diagnosis instead of two. That way, all doctors would be on the same page, and perhaps even making that classification even clearer than it is now, so that that there's no misclassification of patients. Also, perhaps to wait to diagnose children until they're slightly older and out of their energetic stage, so that they don't um, exhibit the same behaviors. There's no compounding factor of their behaviors, so children who are younger tend to be more energetic, and that would kind of remove this, even though it may cause some problems, but it may be something to consider. And lastly, here are the resources that I used to make this presentation. Thank you for listening and learning more about ADHD.